The second and third trimester is often when people feel their best during pregnancy. Nausea and vomiting usually resolve, the risk of miscarriage has dropped, and the aches and pains of the 9th month are far away in the second trimester. Even so, there are a few complications that can occur. Watch this video until the end to learn what to watch out for in the mid and late pregnancy. Number 1. Lower abdominal pain. It's natural to wonder about abdominal pain during your pregnancy. This will feel like a dull ache or a sharp pain on either side of your belly, most noticeable when you cough or sneeze. However, abdominal pain, possibly accompanied by fever or chills, may be a sign that there is something wrong. In this case, it's best to contact your healthcare provider. Number 2. Severe headache. Headaches during pregnancy can be caused by many factors, including hormonal changes, stress, and fatigue. However, if your headache feels severe, it may be a sign of high blood pressure or the high blood pressure disorder called pre-eclampsia, which is a serious condition that can occur after 20 weeks of pregnancy or even after childbirth. It requires medical treatment to protect your health and the health of your baby. Number 3. Vaginal discharge. You'll experience more vaginal discharge than you did before you were pregnant. This is usually a sticky, clear or white discharge caused by changes in your vagina and cervix. However, you could be experiencing a vaginal infection if the color is not clear or white, if it has a bad smell, and if it is accompanied by pain, soreness, or itchy. Reach out to your healthcare provider for diagnosis and treatment. Number 4. Baby's activity level significantly declines. Women often begin to feel the baby fluttering, kicking, or turning sometime between 18 to 25 weeks of pregnancy. Once you're well into the 3rd trimester, your provider may ask you to monitor your baby's movements by tracking how long it takes to feel 10 kicks, rolls, or flutter. There is no optimal or critical number of movements, but generally you should establish a baseline and have a subjective perception of whether your baby is moving more or less. As a general rule, you should have 10 or more kicks in 2 hours. But if an hour passes without any movement, eat a light snack, lie back and try again. If you notice an absence of movement, or if your baby isn't moving as much as usual over several days, call your healthcare provider to double check if everything is progressing well. Number 5. Vaginal bleeding. Bleeding during your 3rd trimester can become serious, which is why it's very important to let your healthcare provider know right away. Bleeding can be a sign of placenta previa, which is when the placenta covers the cervix, or placenta abruptio, which is when the placenta begins to separate from the wall of the uterus. Number 6. Contractions early in the 3rd trimester. Contractions could be a sign of preterm labor, but a lot of first-time moms may confuse true labor and false labor. False labor contractions are called Braxton Hicks contractions. They are unpredictable, non-rhythmic, and do not increase in intensity. They'll subside in an hour or with hydration. If your contractions persist and become painful or regular, it may be a sign you are in preterm labor. In this case, it's very important to contact your healthcare provider right away. Number 7. Your water breaks. Premature rupture of membrane, also known as your water breaking, can show up as a trickle, a steady leaking, or as a gush of fluid from your vagina before your pregnancy is full term. But during pregnancy, the enlarged uterus can cause pressure on your bladder too, so it could be urine leakage. If you are not sure if it's urine or true rupture of membrane, go to the bathroom and empty your bladder. If the fluid continues, then you have broken your water. You should go to the hospital. Thank you for watching this video. If you like my videos, please subscribe and share, and also hit that notification bell and get notified as soon as I post any video. See you soon.